Hello and welcome to our Gold Learning viewers. I'm Fiona Lang-Sharp, IBCLC and Director of Communications and MC for Gold Learning. Well, welcome everyone. I have the pleasure of sitting down with Simone Honikman today, and she's going to be speaking at our upcoming Gold Perinatal 2017 conference, which starts on October 2nd. And she's going to be speaking about common perinatal mental disorders and approach for the maternal healthcare provider. Well, welcome, Simone. How are you doing today?
Hi, Fiona. Thanks. I'm doing well and really looking forward to the conference, hoping to attend a few sessions and getting some interesting discussions going around my presentation too.
Absolutely. And I think that, of course, this is something that it seems like it's getting highlighted more with, practitioners. We're seeing it in the news and media more about mental health disorders. However, I still feel like we're still far behind. I still hear there's a lot of mums I feel like are in the closet with a lot of, what's happening to them. So I know that we need to do better as practitioners. And so I'm excited for you to really address this topic for sure. But let's back up a little bit and let's have you introduce yourself to our audience. Tell them a little bit about yourself and tell them what your practice and what you do on a day-to-day basis looks like.
Okay, I'm a medical doctor from South Africa, and I founded and am directing the Perinatal Mental Health Project, which is a project located within the University of Cape Town, where we operate four different programs. We provide integrated mental health services for mothers attending prenatal or antenatal and postnatal care in the public sector. We conduct training for a range of care providers and are particularly excited about increasing the capacity of perinatal care providers, doctors, nurses, midwives, doulas, in the field of mental health, because we really feel that mental health should be everybody's business, and that with the right kind of training, everybody who works with mothers can be well equipped to manage at a primary level the common mental disorders. Then the third program we run is a research program, and the fourth program we're involved with is an advocacy and policy work.
Wow, that's incredible. I mean, seems like you have the whole spectrum there to cover advocacy, care, education. That's wonderful. It's great. It's great to hear what you're doing, and I hope that you will talk about some of that to our delegates during the presentation, because I know that for some of us in our communities, there's always things changing. I feel like sometimes we're doing a really good job with our mums, and then something changes due to practice or policy making, and then I think, oh, something's going to shift again. So I'm excited to hear what you're doing in your community for sure, Simone, and perhaps it's something that we can duplicate, and that's what, of course, this is all about. When we're here at Gold, we get to share and exchange all this great information. So thank you for catching us up to date on what you're doing in your neck of the woods for sure.
Thanks, Fiona. I think there are some interesting lessons to learn from less resourced settings. In South Africa, we have a very, very high prevalence. About 1 in 3 women around pregnancy in the perinatal period will experience depression or anxiety. So we've had to really think about how to respond to that very high level of distress. And some of the lessons may be applicable for other settings where there are more resources. So it would be great to see if we can share that in the Gold platform.
Absolutely. Wonderful. That sounds great. I'm excited. So tell me too, I would love to know a little bit about how you specifically got into this topic. The perinatal field is very large with many, many different areas that you could have gone into, but what struck you as this one as being important? How did you get into it?
I attended a conference, in fact.
Oh,
I was
really?
invited, yeah, I was invited to a conference given by um, the Postnatal Depression Society of South Africa. And at
Uh-huh.
this conference, there were a range of wonderful international speakers. I had never really thought about mental health and maternal health in the same breath before. I was interested in maternal health from a physical point of view, um, but when the speakers were talking about the impact of depression and anxiety, and in particular antenatal depression and antenatal or prenatal, as we say,
Yeah.
anxiety or depression on the mother and on the infant, the alarm bells went off for me that if we're wanting to impact on society, we need to understand what's happening during pregnancy. We need to be able to intervene early. We need to be able to work upstream to give women and their babies and their families the best possible chance. And it also struck me that to provide physical health alone was really half of the issue. We can't really be effective practitioners if we're only providing physical health, and that there is no health without mental health. And then
Right.
the other thing that was presented at this conference was some local research from a local informal settlement just on the outskirts of Cape Town, where I'm from, which showed that 34% of women were depressed, had diagnosable depression. And for
Wow.
me, that was a game changer. I realized we need to do something about this. This is an epidemic. There is certainly a lot that we can do. Doesn't have to be highly technical. It doesn't have to be highly specialized. There are ways of integrating into the primary interface with mothers an approach to address their maternal wellness and their maternal mental health.
Excellent. Wow. I'm just listening to your story and it strikes me, isn't that interesting that just by attending a conference, this suddenly opened up this huge door for you. And obviously you found your footing in here because this is something you're very passionate about, and I can hear that in you just wrapping up there too. So thank you. Really appreciate you just giving us some insight to how you got started, um, and where it has led you to today. So thank you for sharing that with us.
Sure.
Yeah.
Thank you.
So let's talk a little bit about the presentation here before we let you go. And I want you to share with our audience, because they're listening in right now. They want to know what's coming up here at our Gold Perinatal Conference. So perhaps you can share um, a little bit of a takeaway or a snippet that you're most excited for the delegates to take away.
I'm quite excited about sharing the evidence around empathic care. Empathic care is an approach to being with our clients or our patients that is not necessarily very technical, but has been shown to have quite a significant impact on the mental health outcomes of mothers. So if one is more attuned and more aware of one's own empathic skills, and one can elevate those and work with those, and we are really able to potentially affect significant change in mothers who are experiencing emotional distress. Empathy will allow us to tap into our intuition. It will allow us to detect the common mental disorders far more readily. It will allow us to engage with our clients in the care, in the management, in the decision making around the sorts of care that they may benefit from, and to take them through that journey so that they get the best possible outcomes. So that's something that I'm quite keen to share with the delegates. Yeah.
Yeah. No, and that sounds to me, I think too, that sometimes this is such a big topic, Simone, is that it can feel a bit overwhelming for, for the provider and or someone that's just interested in caring for women like myself as an IBCLC. We often are front line in terms of identifying it, but sometimes it feels very overwhelming with different things happening in the field. And I love what you said, like this could be a low tech, empathetic care, low tech. It doesn't need to be complicated. So having those tools, to me sounds like a wonderful idea. And I can't wait for you to share more of that in your presentation with our audience. I'm very excited. Thank you for sharing that with us today.
Thanks, Fiona.
Yeah. Well, this has been wonderful. Thank you so much, Simone. We're going to let you go now because we've got lots of preparation to do here too at Gold's Perinatal coming up, our conference, which starts on October 2nd. If you'd like to tune in and listen to Dr. Simone Honikman, she is going to be speaking on Wednesday, the 11th of October. Now, do go to our website, check it out at goldperinatal.com. You want to check out all the local times and time zones for yourself, as this is an international conference. So be sure that you have that on your schedule at the right time. But like I said, you can find everything on our website. Well, thank you again to Dr. Simone Honikman today for joining us, and thank you for our listening audience. Bye bye for now, everyone.